My name is Dr. James Perkins. I'm a chiropractor and a naturopath, and I am the Director of Alternative Health Solutions in West Bloomfield, Michigan. And today I'd like to discuss a little bit with you about shoulder problems because it's just such a huge part of our practice. I always say, who doesn't have a shoulder problem? Because it just seems so epidemic in our society. We would like to go ahead and discuss today how we look at the shoulder, a little maybe differently than some orthopedics, maybe not. But we would like to discuss it, and so you'll have knowledge about a shoulder problem if you have one. The shoulder is a very intricate area of the body, has a lot going on there. There's a whole lot of things that can happen with the shoulder, and it can often be mysterious at times. When we look at a shoulder on a patient and they come in with shoulder problems, oftentimes the diagnosis that they've been previously given is often very shallow. The diagnosis could be something like this. Oh, you have bursitis. Let's get some physical therapy. Oh, you have rotator cuff problems. You have a tear in your rotator cuff. I'm positive of that. Oftentimes these diagnoses are not necessarily with even instrumentation or pictures. So what we find is the patient gets kind of confused after a while. She says, well, you don't have bursitis, but we're thinking rotator cuff, and we're not, okay, it's not rotator cuff or bursitis. Maybe you have a labrum tear, and it starts to get very confusing because basically what is happening here is you have a hard time moving your shoulder, can't get it up, it hurts, hard to sleep on it, hard to drive on it. It's been going on for weeks. It's not getting better, maybe getting worse. What's going on? It's very scary to the patient. So they're only looking at the actual shoulder joint, which is a very small component and a very numbered one of the small numbers of the problems that we have. And the reason I say this is because in order to injure a shoulder, you're going to probably have to injure the shoulder with about 1,870 pounds per square inch of ripping, tearing trauma. You're not gonna sleep on your shoulder funny and not be able to use it the next day. This is a fallacy. If you take somebody like Verlander for the Tigers, he's going to throw a ball at 95 to 110 miles an hour, 72 times or 100 times a day for years and years and not really ever have much of a shoulder problem because he's only using anywhere around 760 to 820 pounds per square inch to that shoulder every time he throws. So to fall down a long flight of 23 stairs on cement stairs could possibly injure the shoulder. Other than that, patients come in and say, oh, I slept funny on my shoulder. I haven't been able to move it in any direction for 3 weeks. It's not really possible. So you have to look at really what you have there. If this is your case and you're having severe shoulder problems, you need to come in and see me because we diagnose the shoulder in 4 ways. Number 1, is it a true shoulder joint problem? Number 2, could there be something wrong with one of the 26 muscles in the shoulder, or could there be a combination of muscles that are not firing correctly or not working correctly? So it could be just a simple muscle problem. And those muscles are connected to tendons, and there are also some ligaments in here that can have a problem too. But generally you're looking at shoulder problems caused by the actual joint, the muscles around it, the nerves leading out from the spine in the upper thoracic spine or the lower cervical spine, generally upper thoracic. And the 4th component then would be the emotional component, which is a lot more frequent than you may think. The emotional component to the shoulder can be a tricky one to not so much to diagnose, but a tricky one in order to figure out what we can do and how long it'll take before the shoulder feels better due to an emotional response. And that emotional response is generally a psychosomatic problem because you have 3 parts to your brain. You have a conscious brain, and that operates all your functions. You have a subconscious brain that operates all of your autonomic functions, and you have an unconscious brain which holds a holographic life picture of a life experience of every life experience you've ever had, and that can be a tricky one to kind of work through, but it's not impossible. And the idea is, well, how do you know if it's emotional? Simple. Because if it's not shoulder joint, it's not shoulder muscle, it's not neurological, pretty much consider that it's probably your mother-in-law or your boss or somebody else that some very stressful event. And so we need to talk through that. So the idea here is muscles are basically anterior anchors. They actually will stabilize the front of the body here. There's a group of muscles that stabilize the back or the posterior side here with the scapula. And there's muscles that are muscles of activity for the actual shoulder itself around here. And then the neurological component. And if it's not a joint problem, which is usually diagnosed through ranges of motion of the shoulder, asking the patient for symptom picture, you've got pain deep inside the shoulder joint, not related to muscles, not related to nerves, not some type of stressor or psychological component. You've got a true shoulder problem. In our office, we are not opposed to referring out to good orthopedics and getting more testing and diagnostic testing for shoulders that look like a true shoulder problem. There may be surgical repair necessary. It's very rare. Surgical repair of the shoulder is not very common. So what we want to do is we want to rehabilitate those, and we can talk about that later. But for right now, the key to it is to diagnose the shoulder. If you can diagnose it correctly through sports chiropractic, and that's what we do here at Alternative Health Solutions, you'll get answers to your shoulder problem. You'll get the correct answers. In addition to that, you may be surprised at this, but there's a lot of nutrition that goes into trying to rehabilitate muscles and the tendons thereof. And there's some wonderful new products out, anywhere from collagen to minerals to all kinds of great cytokines and all kinds of different types of anti-inflammatories that are all natural, that can help you tremendously in getting over your shoulder problem quicker. And that's our goal. Oftentimes too, it's rare, but there is a kinetic effect called the kinetic chain. The kinetic chain of events is like this. Carpal tunnel syndrome eventually works its way into the forearm and into the elbow. The shoulder starts to adapt, and before you know it, the kinetic chain works right up into the shoulder, and people are like, oh my God, my whole arm, I don't know what's wrong. I'm numbed in my hand and fingers. I can't hold on to anything strongly. I have problems with my elbow and now shoulder, and it could possibly be a kinetic chain problem. So I guess that would be the fifth way of examining, but that's not as common as it is this whole unit right here. So you just have to know the components of this unit. This little point right here is called the coracoid process. There's 3 muscles that attach to that. The medial head of the pectoralis muscle attaches here. Also, the long head of the bicep muscle attaches here, and the coracobrachialis muscle. So a lot of times this little coracoid process is overlooked by many practitioners as being a cause of shoulder problem. And as you can see why. It's tucked in here, looks just like your little baby finger, curved like that, and it sits right in there like that. Who would ever look for that? We look for it here because it's not all that uncommon to see. You've got a clavicle that could be in trouble, and the most broken bone in the human body is the clavicle. Old breaks in the clavicle are oftentimes unremembered because they're in younger ages. So you have a fracture of your clavicle bone, and that will put compromises on the tendons that attach here to the muscles. So these are all things we like to look at, and it just goes on and gets deeper and deeper and deeper. And of course, the first thing we want to do is the person can't lift a coffee cup and they can't work with their shoulder and they've got some gripping pain in their back, and the first thing we're going to examine is the heart and make sure there isn't anything wrong with the heart, that they're not having some heart problems. That's an ongoing concern for the heart. So these are things that we look at all the time with shoulder, but I just wanted to educate you on the shoulder. If you have a shoulder problem, please come and see me and call me. The number is 855-8707. I'm great with shoulders. And the website again is my-alternativehealth.com. Please go there and look at things talking about sports chiropractic or some of the things that we do, physical manipulation, and come in and see me. It's very important that you get this diagnosed correctly because the speed of the healing process is important, and we can figure out your problem, and that's the key to it. Diagnosis, treatment, not so tough. So with your shoulder problem, I'll see you next week. Thank you.